sin pero, sin pero, sin
So hello guys, welcome back to your channel. This is your आदित्य शिंदे and आपका स्वागत है आदित्य शिंदे इनसाइट्स में. So आज का हमारा लैंग्वेज है अपना हिंदी लैंग्वेज में हम बात करेंगे and we have our base staff of PhD. So आज सर के साथ अपना पॉडकास्ट है. तो सर अपना हमें डेंटिस्ट्री रिलेटेड सारी इंफॉर्मेशन देंगे. So सर एक आपका थोड़ा ब्रीफ इंटरव्यू हो जाए.
Mera introduction. My name is Dr. Abhishek,
Yes.
right? I have completed my BDS and after that I have completed my MDS in public health dentistry.
Yes.
I've also into private ventured into private practice around about the year 2000.
Yes.
So I am in private practice as well from past 26 years.
Yes. Sir.
And I am also having a special interest in dental photography.
Okay.
So I am propagating that as well.
Yes.
I have a special interest in smile design, full mouth rehabilitations, implants, and along with that, I like to teach.
Yes.
Alright.
So, sir, how can you guide for our teenager students, like to how they can start their journey in dentistry, and they can study public and dentistry and everything?
Are you talking particularly about public health dentistry or dentistry in general?
First dentistry, then we will move toward
All right.
PhD.
Dentistry in general. First of all, you should have a good interest in the subject.
Yes. Sir.
It should not only be that you have come to attend BDS because you did not get admission in MDS.
Yes, sir.
If you are studying for BDS,
Yes, sir.
you should be willing to put in the hard work.
Right. Sir.
Right? So, first of all, people should begin with attending the classes,
Sure, sir.
reading up the materials,
Yes, sir.
and know that not everything is available on ChatGPT.
Yes.
Unless and until you put in the hard work for it, you learn the basics from
Yes,
your
sir.
textbooks, not from the notes.
Mhm.
You learn the basics from the textbooks. Listen to your qualified teachers talking
Right, sir.
about everything.
Mhm.
That will make sure that your perspective is very well formed
Yes, sir.
in dentistry. And once you get the hang of what you like, you must be willing to pursue it. There are 11 branches in dentistry.
Right, sir.
Right?
Yes.
Whichever you like, you can feel free to follow that.
Yes.
But first, you should know everything, just that so that you get your BDSD. And that is what is most important.
Yes, sir. Thank you, sir. Sir has tell us very nice information. But still, sir, I want some elaborate answer about how people can fall in love with the dentistry, right, sir?
People can, as students,
Yes, sir.
people can fall in love with dentistry only by becoming meticulous in their work.
Yes, sir.
Because your work
Yes, sir.
should showcase you
Yes.
as a person,
Yes.
that you are an excellent dentist. Whatever work you are giving to other people, you should be passionate about that. It should not only be per se about earning money. You will earn money this way or that way.
Right.
Right?
Yes.
But the money which comes with job satisfaction, that can only come when you are dedicated to your work.
Right.
When you are not making shortcuts everywhere. Alright.
Yes.
For you to make a shortcut, you should know the long cut first.
Yes.
That is very logical.
Right.
So, the basic psychology that you need to make money fast
Yes.
or get successful faster doesn't work in dentistry. If you are dedicated to the work,
Yes.
it doesn't matter what is shown on Instagram or what is shown on Facebook. Those you are never present for all those cases.
Right.
But in your own clinic, you are present for each and every case. So those pictures which you see on Instagram, which you see on Facebook, you can use those as a guideline.
Okay, sir.
But your textbooks are still the best. That you can see. Yeah, I had seen this on Instagram. Maybe how can I reproduce this?
Right.
And that is the way you will get passionate. Something which you see on Instagram, something. And why do you feel people are attracted to it? People are attracted to it because you are presenting on Instagram.
Right.
And when can it become presentable on Instagram? It becomes excellent work.
Sure, sir.
So that is the way it works.
Yes. Thank you, sir. It was one of the best answer I have heard about the dentistry.
Thank you.
Yes, sir. Still, there is one of most doubt asked by my juniors that how to study after having one lecture. What steps we will you will classify that it will be easy us for a revision and study for our exams.
Basic thing is,
Yes.
when you attend the lecture, people should be attentive to what the person is trying to teach.
Yes.
Right? We are not expecting you to write down the entire thing, but at least you should make efforts to ask the lecturer or your teacher what you have not understood. Right? Whatever doubts you have has to be cleared in the lecture itself or immediately after the lecture.
Okay.
Right? So we do try our level best to make it as easy as possible for you.
Yes.
But then the reciprocation from the students also has to be in the same manner.
Yes.
Once you do that, once you understand, once your doubts are clear, right? First thing is you have to clear your doubts.
Yes,
If you don't understand anything, do not sit mum. Ask questions.
Yes.
Right? And after you go back to your hostel, just go through that once again.
Right.
And if you do have a textbook with you, read that chapter thoroughly so that will be the end of it. I mean, you will probably able to absorb that so well that you will not be able to absorb that well if you are reading it later on.
Right.
So that is the first thing. Revision same day is very, very important.
Yes. Yes, sir. Sir, what do you think that should we make notes of the from textbook or we should write in textbook itself? It will be our notes.
You can mark in your textbook if you can remember it,
Right.
right? But it always, for me, it has always helped that whatever important I thought, I made a small book. In that, I have written down in short
Okay.
that if there are 8 or 10 points, I have written down little bit by little bit. So even if I just look at it, I know what is what.
Yes.
A reference book, if you say. I mean, you cannot possibly carry your textbook everywhere, right?
Right.
So if you make a small reference book,
Yes.
then provided you have studied well, provided you have read properly from your textbook itself, it is very, very easy for you to recollect everything
Right.
and write down. Basic thing is you need to mug up the things, first of all.
Yes.
First, you need to understand.
Yes.
Second thing is you need to mug up.
Right.
And third thing is make a reference list so that you understand it
Yes.
wherever you see it.
Right. Yes, that's a very nice technique, sir. I will just follow in my curriculum also. Then, sir, how you tell our juniors like they are like in my batchmate third year, second year, first years that what should they do in their standards and then come to fourth year? What things they should complete before coming to fourth year as of study in PhD?
In public health dentistry,
Yes, sir.
first of all, you should be reading from the textbook.
Right, sir.
Unless and until you read from the textbook, only the notes or the PPT is never going to help you.
Yes.
All right. Being the subject the kind it is, the repetitive learning is very, very important. So that is, like I said, you need to have a small book on which you can just write down. Maybe if you write down the initials of the thing, you'll be able to study that.
Yes.
Then you should be able to study all the definitions.
Right.
Basically, those are the important points in each and every. If you take the question papers of past 10 years, you are going to get probably what all are the important questions in that. Right? Go through that. You can't go wrong with that.
Right.
All right. You take the effort to get 10 years question paper, go through that, see what are the all of the questions which are asked. The textbook is the same.
Hmm.
Whatever you are going to talk about is the same.
Yes.
Whatever is being taught is the same.
Hmm.
Except the newer editions are making additions of whatever newer knowledge is there.
Okay.
The basics never change.
Right.
Right? So
Hmm.
first you got to know the basics.
Yes.
If you don't know the basics, you will always try for the shortest definition.
Hmm.
It is not the ideal definition.
Hmm.
What if you give the ideal definitions, you're going to get most marks.
Yes. Sure. So one of the most important thing I want to ask is during exam preparation, right? People start preparing for before 1 month or 2 months. They don't regularly study, so they just use a chat, just use Chat GPT or everything. They do not follow standard textbooks and all. So what things you should aware? What things should you tell to make them aware that what they are doing wrong?
The chat GPT is taking away your capacity of thinking.
Hmm.
That is what it is doing.
Yes. Sir.
So, I mean, you don't want to look for yourself.
Yes.
You don't want to do anything for yourself.
Yes.
How are you ever going to become a good dentist? Do you
Hmm.
feel chat GPT is going to come and do your cases?
Mostly.
You have to learn crown cutting by yourself. You have to learn extraction by yourself. It is at the most a guideline, or just
Hmm.
like Google. We didn't even have Google.
Right. Sir.
First there was Google, now you have got Chat GPT.
Yes.
But then people are becoming lazy and they don't want to teach or learn for themselves.
Yes. Sir.
So if that is the way you are going to study, your knowledge is going to be only limited to Chat GPT.
Yes.
And it is not that AI has all the knowledge.
Hmm.
It it is written in the Chat GPT itself.
Hmm.
Chat GPT is a AI and it can make mistakes.
Hmm. Yes. Sure.
You understand?
Right.
So it is bound to make mistakes.
Yes.
So unless and until you take the help of your textbooks, how are you going to know that what it is saying is true?
Hmm.
If you do not look at your textbooks, do not look at whatever notes. I mean, like, let's say I am teaching you.
Hmm.
I have been teaching for now past 25 years almost.
Yes.
So doesn't 25 years of experience make a difference
Hmm.
over 5 minutes of chat GPT? And I can simplify it in ways chat GPT can never.
Hmm.
It
Yes.
can type down, it can ask you whether I want to give you this, I want to give you that, whether you want all these things.
Hmm.
Whereas when I am taking a class, I know
Hmm.
what these students need.
Yes.
So you can just write down that much.
Right.
And I know if you write down that much, you are going to pass. Chat GPT doesn't know that,
Hmm.
right?
Right.
So that is the biggest difference.
That's more important thing you have tell. Then what people should follow in their clinical posting, right? For becoming a good dentist.
Good case history taking,
Yes.
first of all.
Yes.
Half of your job is done well when you are taking a proper history.
Right.
Most of the complications will never happen if you take a good case history
Right. Sir.
first.
Yes. Sir.
Okay?
Yes.
That is very, very important. That you know what all, now let's me not go into case history taking,
Hmm.
but you know what all are the important things you want to ask for,
Yes.
what
Sir.
all medical conditions are there, what all can have a probable effect
Hmm.
on your treatment.
Yes.
All those things you should know, right? That is the first thing.
Hmm.
Second thing, you should be hungry for work.
Right.
That does not mean direct go to extract the third molar. If it is grade 2 mobile central incisor also, if they give you, you should try to extract that painlessly
Hmm.
without breaking it.
Yes.
Before breaking the teeth, or before doing any other treatment. Let's not, what do you say, generalize about oral surgery itself.
Hmm.
It can be any department.
Hmm.
If it's cons, first learn to do a pit and fissure.
Uh,
Learn to do a class 1 cavity.
yes. Sir.
Straight you want to go only for root canal,
Hmm.
or you want to go for inlay, onlay, or some fancy thing.
Yes. Sir.
it's not as if you are going to get only patients of inlay or onlay, right?
Right.
So whatever you are going to learn here, that is very important.
Yes.
But you have to show interest
Hmm.
and put less attention in mobiles,
Hmm.
because if you keep on scrolling through reels the entire day, you are going to earn nothing.
Uh,
Take it from me.
right.
Okay, you will just be very nice reel star, but you will earn nothing. For earning, you need to have good clinical knowledge.
Yes.
That is very, very important.
Because now let's move towards a PhD, sir. How can you guide how to study subject PhD, and as well as what tips you can tell to our viewers?
Public health dentistry is a vast subject.
Right.
Involves your field trials,
Mhm.
it involves your viva, it
Mhm.
involves your case history taking. So all of them are interconnected, like
Right,
I
sir.
said.
Mm.
First, always and foremost is the survey, which falls into public health dentistry. So you need to study that. You need to study the indices properly. The indices, unless and until you know, you are not going to be able to diagnose the disease as it is.
Yes.
You should be able to know what is the provisional diagnosis for this,
Mm.
what is the, what is the levels of prevention.
Mm.
That comes under clinical part. Rest, you should be able to know what are the important milestones in public health dentistry. You should be able to know what are the different studies which have been conducted.
Yes.
Understand, like water fluoridation studies. There are lots of topics in this, but you know it.
Mm.
Understand. So that is the important ones. That, like I said before, you have
Mm.
to get it from the previous year's question
Mm.
papers.
Yes, sir.
Understand?
Right.
So you will get an idea what you have to study, because otherwise it is humanly impossible for you to learn the entire textbook.
Yes.
But whatever topics are there, and study topics as per their importance which are there.
Mm. Right.
I mean, those which are for 2 marks short notes, those you need to put less pressure on than what you will get for 10 marks,
Mm.
right?
Right.
You need to understand what is the amount of weightage which is supposed to be given to each and every topic or
Sure.
each and every chapter.
Okay.
That you will come to know when you attend classes.
Right.
That is the basic thing. When you
Mm.
attend the classes sincerely, when you are listening, your lecturer is obviously going to tell you that this is a important part of the
Mm.
lecture. You please remember this.
Mm.
This can come as a main question. This can
Yes,
come
sir.
as, understand.
Yes, sir.
So that is one way. After that, you have got all the survey procedures. Again, basic thing boils down to that: how well you do your case history,
Yes.
how well you do your studies,
Mm.
and how well you diagnose,
Okay, sir.
and levels of prevention. That should be good enough for you for public health.
Sure. That's a very fabulous answer, sir. And we are happy to have you on our channel. The most important thing I want to ask on the behalf of my viewers, that the only thing you should you should do as a dentist for awareness to related to public and dentistry means how you can aware the peoples related to dentistry and dental problems, that they should regularly attend dental checkups and all.
Well, you can use reels,
Yes, sir.
100%.
Yes.
You can use reels. You can use posts
Yes.
on Facebook,
Hmm.
on wherever on social media. You can use your posts.
Yes.
You can use your reels.
Yes.
Those are very effective nowadays.
Yes.
Then you have your camps. If you are in
Dental
college,
camps.
then dental camps. Then there and then you can educate your people who are coming to the camps.
Hmm.
Then you can go to different schools
Hmm.
wherever there are camps. You can educate over there,
Right.
right? There are so many. Catch the people, catch the students young. You
Hmm.
can really make sure that they are brushing properly, doing their oral
Okay.
health exams properly. And when you teach young children,
Hmm.
they are more uh, they are more prone to attend and come to your clinics and get the checkups done
Yes,
basically.
sir.
Yeah.
As of one of biggest problem in my village, I live in village.
Mhm.
So the people are eating gutkas, tobacco, and all thing pan masala.
Mhm.
So and they just came after the tooth is completely damaged or all.
Mhm.
So what thing I can tell them, that like in such cases like heart attacks and all, even carcinoma and everything just
Mhm.
occurs. How can I guide that people? That,
You do not have to wait till somebody gets carcinoma or
Mhm.
something like that.
Yes, sir.
You can always gather up the people. There
Mhm.
are occasions such as No Tobacco Day.
Right, sir.
There are occasions such as Oral Health Day.
Yes, sir.
You can always make a lecture or
Mhm.
make a presentation for the people.
Yes, sir.
You can always send down some pamphlets which are there, which
Okay.
can be distributed on behalf of your clinic,
Right, sir.
right? And you have to make sure that the communication is in their language so that they understand what it is about,
Yes, sir.
right? So you can help a lot. And even when patients come to your clinic, you should make a diligent effort to tell them
Mhm.
this is all what is happening because of the gutka
Right, sir.
or tobacco or whatever it is.
Yes, sir.
Understand? So your basic outreach has to be towards the public.
Right.
And when that happens, slowly and steadily, people do understand.
Okay.
Sadly, some people never do, but
Mhm.
most of them do understand.
Right. Thank you, sir, for your such a wonderful time and your knowledge. We will seek you in next interview and podcast. Thank you so much.
Thank you.
Yes, sir.
Thank you for inviting me and
Yes.
having me over.
Thank you, sir. Yes.